It's a Thursday edition of the Bold Republic Radio Show. My name's Glenn Woods. Thanks for joining me. So Thursdays, of course, mean we head all the way down to Cheyenne, Wyoming, where Maureen Bader is standing by to give us the latest on what they swear to us is for the good of us all, despite our best intentions, not theirs. Did I get that right?
I guess, yeah.
Okay, sounded okay to me. I just kind of rolled out that way. No matter what our best intentions are, theirs are better. And somehow theirs never work. I'm confused, Maureen. How are we doing with, in this state of Wyoming, with the idea of Medicaid expansion? And you sent me a little list to look at of who are the people that are voting for it.
Yeah, well, as you know, here in Wyoming, we have not expanded Medicaid.
Right. Wait, hang on a second. Yay! Go ahead.
But what I like to call the expansionistas
Yeah.
have fought very long and hard to inflict Medicaid expansion on the people of Wyoming.
The expansionistas.
Expansionistas.
Expansionistas. I can't do it the way you do it, but that's good. I like that.
Yeah.
Yeah.
So luckily for us, we just had the 7 members of the Joint Appropriations Committee rescue us by voting to strip Medicaid expansion from the budget that they're currently working on. Now, I think part of the problem is that Governor Meade and the other expansion cheerleaders, or these expansionistas, appear just to be blinkered to the facts of reality about socialized medicine. They really do seem to be confusing health insurance with health care.
Yeah.
And you know, if you go to someplace like Canada, I mean, I talk to a lot of people here in the U.S., and they know Canadians who've come down from Canada, the single-payer utopia, healthcare utopia, because they can't get the health care they need in a timely manner. So they come to the U.S. Now, if you socialize the system here in the U.S. as well, where are people going to go to get timely care? The idea that if people have insurance, they're going to be able to get health care, I think is what really confuses people. And that's a myth we definitely have busted down here. On our website, we have got Charlie Katibi, who wrote a paper called Medicaid Expansion, Myths and Realities, and you can read about those on our website, wyliberty.org.
Good plug, real quick. And no, I'm proud of you because you know how to just slip those in there when people aren't paying attention. So, I know by now, because I keep asking you this, and I've asked Charlie this, these people must have seen the evidence that's been presented to them on how bad it is for other states that have expanded.
Well, it's like I say, they just seem to be blinkered. You know, they say, well, you know, we're going to. This was one of the things that Matt Meade, our governor here, was trying to convince people that, gee, if we only expand Medicaid, we'll actually save money because we're going to get all this free money from the federal government, and we'll be able to offload some other costs to the federal government instead. The problem, though, is that when other states have expanded Medicaid, the estimated number of people who are going to be on the program was 2 to 3 times higher. And so now what's happening is a lot of these budgets, governors in other states like Colorado, for instance, are trying to figure out where in their budget they're going to spend less, like highways, for instance, or education, so that they can spend more on the expansionista population. So you know, it's very odd that you have all this. We're surrounded by all this evidence, and yet the expansionistas are saying, well, we still need to expand. Now, luckily, the people on the Joint Appropriations Committee do seem to be paying a bit of attention to what is going on in the real world, and so as a result, we managed to have enough votes to remove Medicaid expansion from the Wyoming budget.
Okay, now, the problem is, and this is where I guess some people just they're stubborn, they don't want to listen. Even though it seems to me the people of Wyoming have been very clear, the majority seem to be saying, we don't want this. And when you take a look at the legislature, the House and Senate, it's been blocked and blocked and blocked. Mm-hmm. But that doesn't seem to matter to the expansionistas. I'm just not going to be able to say it the way you do. That no matter what, they're going to find a way to trick us into... I mean, I was talking to one of our representatives just a week ago from up here in Gillette. And she even told me about a way they tried to slip it into a bill under a different name. I mean, so... if they can't get it passed through because obviously the people don't want it, then they're going to trick it through.
Yeah, transparency is becoming a bigger and bigger problem here in Wyoming, not only with trying to sneak things in to the budget like Medicaid expansion, but in other areas as well where they're trying to offload costs to big projects like the Capitol renovation into other budgets to try to hide these cost overruns.
Now, you see, what Maureen just did there is called a segue. It was very clever. Once again, it was hidden, a lot like the plug for her website. Suddenly, we're talking about something else. Did you notice it? Because I noticed that. That was very good, Maureen. I'm proud of you.
Oh, well, thank you very much.
Very
but before
good,
we
yeah.
go to that, before we segue into that other topic, we have to be sure that people understand who on the committee voted to expand Medicaid and who on the committee voted to keep Medicaid expansion out of the health department's budget.
Let's
because
have some
someone from Campbell Converse is an expansionista.
Aha. Who?
Your very own Senator Wasserberger.
That doesn't surprise me a bit. Okay.
Yeah, he voted to keep Medicaid expansion in the budget. He was right there with the two Democrats. We had Representative Conley and Hastert. Representative Conley is from Albany, and Hastert is from Sweetwater. They're the Democrats, so you expect them to vote for Medicaid expansion. But we also had Bob Nicholas, who's from Laramie. Now, Bob Nicholas is the brother of Phil Nicholas, and people who follow the legislature know that Phil Nicholas is in fact the most powerful legislator in Wyoming. He's in fact more powerful than Governor Meade. He's that powerful.
Wow. How does he get to be that powerful? What's the deal?
Well, his secret, I think, has been to know the budget better than anyone else, than anyone else. Also, he's got an attention span that no one can match, and he also can go for hour after hour after hour after hour without a break in a meeting. So if you're actually one of the Joint Appropriations Committee members from a couple of years ago said to me one time, you get up, you go to the bathroom, next thing you know, you come back and something's been passed that you didn't want. I mean, that's
okay. So this guy's more powerful than Governor Meade because he doesn't have to go to the bathroom as much. I got it.
You said that, not me.
Clear. I'm perfectly. It's my job to say these things. That way you can stay classy. We both know I'm not. Okay. Any other names on the list you haven't gone to?
Yeah. So, and Tony Ross, also, who's a senator here in Cheyenne as well. He works very closely with Phil Nicholas to not only try to do who knows what with the Medicaid expansion, but also with he was also very instrumental in trying to hide capital renovation cost overruns as well.
Right. Okay.
But we've got some people we should also mention in a positive way. So I realize it's kind of unusual for us here.
Okay. No.
And we had Representative Tim Stubbs from Natrona, who was the one who brought the motion to remove Medicaid expansion from the Wyoming budget. And he was supported by Representatives Burkhart from Carbon County and Harshman from Natrona County and Representative Moniz from Albany and Greer from Bighorn. And the senators were Senator Perkins from Natrona and Burns from Sheridan. They all seven of those voted to remove Medicaid expansion from the budget. So they're definitely people that we should be pleased with, even though they may not necessarily vote in what we might consider to be the right way, or just like your little segment before that talked about voting in a consistent way based on your principles. They don't always seem to do that, but they certainly voted the right way in this case.
Right. Okay, good. And I'm just still worried, always am, because, again, when the will of the people has been made perfectly clear, there are still those who are trying to find any kind of trickery. There's all sorts of ways to hide proposals or hide it in the budget or change the name of something. At some point, I completely expect expansion to be renamed again, and they're going to try to slide it into something we've never thought of, and next thing you know, Wyoming has it. Because it doesn't matter what we think. It doesn't matter what we want. It's what they're going to do to us. So.
Yeah, you're absolutely right about that.
Yeah, okay, now let's get back to the capital thing here. Now, the reason I'm so fascinated with this, Maureen, is not just Wyoming. Every single time I see a city government, and city could be from the size of, let's say, where I am in Gillette, which is like 33,000 people, to Chicago, and it can even be a state capital. They always say it's going to cost this much, and I've yet to, maybe somebody out there, but I've yet to find a capital that stayed on budget. They didn't just go a little over budget. They went massively over budget. Mm-hmm. And then just like with Medicaid expansion, they have to find ways to hide the money because they can't be honest with the people. So what's going on?
Yeah, well, unfortunately, what's happened down here with the capital renovation project is that it's gone from essentially a basic renovation. I mean, I don't think you'll find anyone who says that the building doesn't need to be renovated. It was built, around the turn of the last century. It had a partial renovation in 1985 and has basically had nothing since then. So, I mean, obviously it needs work. You just need to look at the pictures. You can see that the plumbing needs to be replaced. The electrical is a disaster. It's got no fire suppression. The rocks, the stonework on the outside is crumbling. So it definitely, the work needs to be done. But do we need to build a Taj Mahal here? And some legislators, especially the ones with the biggest egos, certainly seem to think that is the case. What has happened, though, last summer is that Governor Mead essentially drew a line in the sand at $300 million. He said, this budget will not go above $300 million. Now, recall that the project cost recently escalated from its 2014 appropriation from $259 million to $299 million and change. So, we're right at that line in the sand right now. So we've got, again, with this Senator Phil Nicholas from Albany saying, well, what we really need to do is make the Capitol a really awesome place for people to come and have it be more of a tourist attraction and have people learn about their state government. All these kinds of things that the building is not really intended to be. It's intended to be the seat of government, not some kind of tourist attraction. But how is that going to get paid for? We're already at the line in the sand. So what are you going to do? Well, the first thing that they did was have a consultant come and essentially, the first thing they really did was decide they were going to get a consultant to tell them what it is they needed to do. That consultant was going to cost about almost $100,000. And that was when we first started to get this idea that maybe they were going to start shifting the budget or the spending into other budgets. Because, in fact, somebody from the Attorney General's office, when they were asked, well, where is this $100,000 going to come from? He said, well, there are different budgets that it could come from, like the tourism budget, from the administration and information budget, from school facilities of all things. You've got school facilities that potentially could be $500 million in the hole by the 1920 biennium. He's saying, well, we could just take money out of their budget. So this is educational related, But at the time, for whatever reason, in a good way, Governor Mead said, I worry that we're going to start going down this road and picking pieces from other agencies. It'll be more difficult to get a true cost of the project. He's absolutely right. Once you start offloading the costs to different agency budgets, how does anyone ever keep track of how much was actually spent at the end of the day? So he was absolutely right that for transparency, the cost of the project should only come out of the project budget. The costs should not be squirreled away in other agency budgets.
What gets me is the excuses that they come up with for this. This is an educational tool. And because it's an educational tool, it's for the children, Maureen. You got to understand. So because it's an educational tool, we have to make sure that the kids are taken care of, and so we'll go ahead and put it in the education budget. Because of tourism, Maureen, we have to increase tourism because that's a vital industry. So we'll make it part of the tourism budget. So this is where they get out of honesty and get into the dishonesty of let's make up whatever we can so we can spend as much as we can. Don't answer that yet. Hang on. More with Maureen Bader in just a moment. Maureen Bader from Wyoming Liberty Group. So here's what I was thinking about during the course of the break, Maureen, is between both the stories that you gave us today, where they're trying to do Medicaid expansion, they're trying to work on the Capitol. It's a typical problem, isn't it, with government in general. I would say this is a very typical problem. We should have a system in place, and it was meant to be this way in this country, where if the people said, we don't want this, then other than trying to convince the people why they might be wrong, that was pretty much the end of the discussion. It was the idea of a representative republic. But instead we have a system where, we can't get support from the people, so we're going to ignore them and try to hide what we're doing here, and until it's too late for them to notice. You could write a book on this.
Well, I think what you're sort of outlining is a basic problem with our system, and that is when we talk about the people, you really need to ask yourself, which people?
Yeah.
Because certainly some people are being represented here. Now, the Medicaid expansion so far, the majority of people are being represented in that particular case, as long as it doesn't get snuck back through again somehow. Because even during the Joint Appropriations Committee discussion, we had this Kathy Conley, who's the Democrat from Laramie, who voted to keep Medicaid expansion in the budget, saying, "Well, I have received a lot of calls from people who disagree with Medicaid expansion, but I also have received a lot of calls from people who agree with Medicaid expansion." So she's just going to go with the people that she agrees with, because this is something that she wants, because according to her ideology, the government is the one who's supposed to be taking care of people's health care needs. Now, I don't know about you, but I would prefer to have a doctor take care of my health care needs. And I'm quite happy to pay for it myself. I mean, and it's really true right now. The cost of health insurance here in Wyoming is very high, but adding more government and more distortions to the industry is obviously not going to make it cheaper. In fact, with Obamacare, which was supposed to make everything so much better, you're going to keep your doctor and things are going to be cheaper, the cost of health insurance has actually gone up in this state. Mm-hmm. So what we need to see are reforms that get government out of the way, that reduce the cost. I mean, in the case of health insurance, one solution would be to have health insurance sales across state lines, because sure, you've got a very small population in Wyoming, a very small risk pool, and therefore the insurance cost is going to be higher. But if we have got a national risk pool, just like with auto insurance, then our health insurance, like our auto insurance costs, would be much lower, because the risk pool is much bigger. I mean, that's a fairly straightforward solution, and for some reason, the powers that be are not moving forward with it. And the same with the capital. We've got certain people who've got these grandiose ideas about what a capital should be based on what they think. They happen to be very powerful. They're able to drive their desires through. I mean, the number of people that I've spoken to, and even callers on other radio talk shows, that are absolutely outraged about the entire cost. I mean, $300 million is a lot of money to repair. It's more than just repair the Capitol, but for this particular kind of project, it's a lot of money. We're in a situation now where we just don't have the money. Where's that money going to come from? Well, we're seeing now already. When in fact, when they did actually vote to put the capital renovation cost into the State Parks and Cultural Resources budget, of course, then the big question became, well, exactly what money are we going to use? Because we're still in the hole on the general fund operating budget, and who knows where the money for capital construction is going to come. We potentially could have a $500 million deficit in the school funds in a couple of years. So where's the money going to come from to pay for this tourist attraction at the Capitol? Well, it turns out that the Wyoming State Penitentiary had squirreled away, so essentially the Corrections Department for the Wyoming State Penitentiary had squirreled away in its budget about $1 million to fix the north building at the penitentiary, which is out near Rollins. And what they decided to do was say, maybe we don't need to repair that building. Let's just put that money towards the Capitol, and that's where the money is going to come from. So do you want to talk about smoke and mirrors and lack of transparency? The Capitol renovation project is becoming a really good example
We
of
should
that.
just make the prison a tourist attraction. That'll fix that problem. Where do they find you, Maureen?
Go to our website, wyliberty.org, and you can find articles on both of these topics there.
All right, Maureen, as always, thanks for coming on.
Thank you. Bye now.